Good evening, ladies and gentlemen. My name is Ben Johnson. I'm a nurse in the surgical ICU in Tupelo, Mississippi. I currently have 1 year of experience, and I'm undergoing my bachelor's degree bridge program at Mississippi University for women at the time. I'm here today to talk to y'all about something that is a very common occurrence nowadays that used to not be discussed much, but it's becoming more into the light now because it's causing a lot of potential problems that could affect not only us but the generations that come after us, and that is something called antibiotic resistance. Um, Antibiotic resistance. First of all, let's go over our objectives for today. First, what we're going to try to talk about is we're going to try to develop an understanding of what antibiotics are and what they're used for. A lot of people, especially youth and older generations, will go to the doctor and they've heard the term antibiotics, but they don't actually know what they are or what they're used for. They just know it's something they get when they get sick. So that's going to be our first objective, is to develop an understanding of what they are. And then secondly, we're going to learn about what antibiotic resistance is and how it's caused. Um, like I said, it's a growing problem that we need to be taught more about, and we need to be talking to our patients more about. Thirdly, we're going to learn the consequences of developing antibiotic resistance and how it affects not only us but our future, the children, and our generations to come, as well as even our food supplies. So, what are antibiotics? Antibiotics are a drug class that are prescribed to fight bacterial infections, which may seem common sense to some, but to others, may not know that. There's hundreds of different kinds and 7 different categories of the drug. But like I said, they're used to treat bacterial infections. Um, some types of bacterial infections that are real common that we see, on a day-to-day basis are urinary tract infections, strep throat, and most ear infections are bacterial as well. Some sinus infections can be treated bacterial. They can go either way. They can be bacterial or viral. So those are what antibiotics can actually treat and what they're supposed to be used for. Now, however, we need to talk about what antibiotics cannot treat, because that's a large part of the problem that we deal with the resistance. Antibiotics cannot treat viral infections. Viral infections are things like the flu, like your general sore throat, other than strep, just your sinusy sore throat, and the common cold, which everyone gets from time to time, is generally produced by a virus. And antibiotics will not treat any type of viral infection. They're only for bacterial. Antibiotics, this is just a disclaimer, they do come with many side effects. Commonly, they'll come with gastrointestinal, stomach upset, some diarrhea, cramping, but they are also one of the most leading causes of emergency room visits will be from antibiotic reactions. A lot of people take antibiotics not knowing what they're allergic to, and can cause a lot of reactions, as some of us in the crowd here know, may be allergic to some. Another really bad side effect from overuse of antibiotics could be an infection called C. difficile, which is an infection you get in your gut when you take too many antibiotics, which kill bacteria, and it actually ends up killing off the good bacteria that's in your gut that you need to digest food and to balance the flora out in your system to stay healthy. C. difficile is a nasty infection that I've seen several times in the intensive care. Very hard to treat because it's already the absence of bacteria, and an immune bacteria. It's resistant to several drugs, and the ways they treat it are not pleasant, like fecal transplants and some other odd stuff. Every time you take an antibiotic, especially if you take them incorrectly or for the incorrect amount of time, it does increase your chance of developing antibiotic resistance, which is the final side effect and the one I'm really here to talk to you about today. Like I was saying earlier, these are just some pictures and some graphs and what I, kind of demonstrate what I'm talking about. 1 out of 5 emergency department visits for adverse drug effects, adverse reactions are from antibiotics. Uh, a lot of people, one that's really common that people are allergic to would be sulfa drugs. I myself am allergic to sulfa drugs. And then penicillin, actually, especially in the older populations, there tend to be a lot of reactions to penicillin. I think it's because of the overuse of penicillin, decades ago, when that was all we really had to treat things. Reducing antibiotic prescriptions in hospitals can lower deadly diarrhea infections by up to 26%. Like I was telling you earlier, one of the main side effects from antibiotics is diarrhea and stomach upset. Diarrhea removes fluid from your body at a rapid pace, which can end up being dehydration, and that's how a lot of people end up passing away. So, to the meat of our subject here today, antibiotic resistance. What is antibiotic resistance and why should I care about it is really why I'm sure everybody's asking themselves here today. Like I said, it's a very important thing. Antibiotic resistance is the ability of bacteria to resist the effects of an antibiotic. This comes from, think of it, as an analogy. Think about it as yourself to a sunburn. You're out in the sun, you may get burnt the first time and it destroys your skin cells. Every time thereafter, you're a little more immune to the sun. You have a little bit, thicker skin, more tough. That's kind of what antibiotics do with what bacteria do with antibiotics. Every time they experience it, they learn from it and they become more and more resistant to it, to where it doesn't work on them as well the next time. It changes the way the bacteria is made. Its overall chemical structure can actually be changed, and the bacteria can survive future treatments from that antibiotic and continue to multiply in the body and cause harm. Like I said earlier, it's much under discussed, but antibiotic resistance is one of the world's most pressing public health problems at this time. We're really, in the last several years, have just started to talk about it more and just started to push the education more on it. But antibiotic resistance in children and older adults are a particular concern because these age groups have the highest rate of antibiotic use. When you first, how when you have babies, anytime they have an ear infection, anytime they have a sinus infection, take them to the pediatrician, and we do a round of antibiotics. And then also when you get older, things like UTIs become more common, eye and ear infections become more common. And as a result of those, you're exposed to more antibiotics more frequently than you normally would be. This is a graph kind of helping in picture form describe how antibiotic resistance occurs and how it goes about. You have a lot of germs. These are your bacteria in here. And just a couple of them will be drug resistant. The antibiotics, they'll come in and they'll kill all the others that aren't drug resistant. But the two that are, have seen that antibiotic before, they'll survive it because they've built up a resistance to it. The drug resistant bacteria will then spread, multiply as bacteria do, and they'll rub off, for lack of better terms, on the other bacteria and kind of share their durability with them to where the next time they encounter it, they'll also be resistant. Why is this important to healthcare professionals? It's because at least 30% of antibiotic courses prescribed in the outpatient setting, like your clinics, pediatricians, ear, nose, and throat doctors, things like that, are unnecessary. They're prescribed for infections that can't be treated by antibiotics anyway. They'll, unknowingly sometimes we'll prescribe them for viruses, which, like I said earlier, can't be treated by antibiotics. Or, in today's healthcare setting, a push for patient satisfaction is a major key, and patients are unsatisfied if they go to the doctor and don't leave with the medicine. So doctors will oftentimes, they've reported prescribing broad spectrum antibiotics such as amoxicillin, which is a penicillin derivative, just to more or less appease the client. Total inappropriate antibiotic use may approach 50% of all antibiotic use, which means there's a 50-50 chance you don't even need the antibiotic you're getting when you go to the doctor. And in the last year, since 2014, I believe, when this research was done, about 50% of them were unnecessary. Overuse of antibiotics is both expensive and a dangerous act. We know the cost of healthcare is rising. We know the cost of healthcare as a whole, our whole healthcare system is going up. This here says the total cost of antibiotics in 2009 was $10.9 billion, which, if we remember earlier, I said 50% were unnecessary, which means almost $5.5 billion spent on antibiotics in 2009 were unnecessary. And these numbers vary from year to year. I think with the continuing education we're doing now and the big pushes we're doing in our clinics and in outpatient settings, I'm hoping that will decrease significantly. How earlier I said it can affect your food supply. antibiotic resistance can. And that's a very true reality that's coming about. As y'all know, I'm sure you see packages that promote antibiotic-free chicken eggs and antibiotic-free food, and that's because some industries and companies are beginning to realize the dangers of resistant germs that can come about from treating their animals with antibiotics. Antibiotics are often used in farms to treat infections or prophylactically, which means ahead of time, just to keep an animal from getting an infection, especially with our chicken crops, our fish, and our beef. Once we administer several antibiotics to animals who don't need them, they too, just like people, their bacteria will become immune to the antibiotics, and in which case they'll spread, and they can actually be spread from animal to animal and from animal to food. Animals excrete feces, they poop. So with those antibiotic resistant germs that are in their gut be passed into our food supply, into our grass, or into our streams that we use to water our crops. And these drug resistant germs are getting spread everywhere, just from the simple administration to animals. Because after they excrete their waste onto the crops, they're ingested by humans, and if they're not properly cooked, people who like to eat their steak rare, or they don't wash it properly, their vegetables, they can be spread into our system through that. They can also be spread through irrigation, like I said, through the water supply. All our water, is in the system and reused. This is just a graph to demonstrate what I'm talking about. We give our animals antibiotics. They'll kill off most of the bacteria, but there'll be the one germ that's resistant because it's seen it before, which will then multiply. Then after it multiplies, it's in our food, it's in our crops, like I said. Prepared food on contaminated surfaces, those who don't wash their cutting boards appropriately or wash their hands appropriately can be exposed to those, and undercooked food. It's a growing concern. A lot of like salmonella and stuff like that. You already see those effects. You hear about recalls all the time from salmonella. Luckily, we can still treat salmonella fairly well, but we're years away, hopefully more than years away from coming up with a super virus or a super bacteria that we can't treat with antibiotics because it'll be resistant to everything. And this study showed that 1 in 5 resistant infections are caused by germs passed through our food. So 1 in 5 of the infections you receive typically come from food. So why does all this matter to us? It's because we're the ones that can stop it. Us as a whole, not you and I, but everyone, and the spreading of the knowledge. Antibiotic resistance is an incredible threat, not just to some, but like I said, everyone in the world. With more resistant bacteria being formed, who knows when one big bacteria will come along and cause a widespread breakout that we have no way to treat because it's immune to all the bacteria that we already have today. And as much research and money as they put into forming new drugs, sometimes it doesn't always go as quickly, and we don't know what's going to be formed, so we don't know how to treat it yet. So what can we do as people? Don't go to the doctor and ask antibiotics for simple colds and stuffy noses and sore throats. Try home remedies first: nasal sprays, warm fluids, hydration, and plenty of rest. Always finish your antibiotic treatment when you do take them for bacterial infection. Say you do get a course of, a case of strep throat or a ear infection. When you go to the doctor and they prescribe you that amoxicillin, take it twice a day for 10 days, be sure to take it for the full amount of time. Taking it for a shorter duration neglects it does away with the benefits of the drug because you're not giving it time to work. All you're doing is exposing the bacteria to the antibiotic, giving it time to build a resistance, but not giving it time to kill it. So you're increasing your chance that much more of developing an antibiotic resistance to that drug. How to prevent illnesses altogether? Like I said earlier, you want to drink plenty of fluids, get plenty of rest. People underestimate the power of 8 hours of sleep. Try some over-the-counter drugs first and decongestants, nasal sprays, just for your minor colds and stuffinesses. Eat a well-balanced diet. I recommend a multivitamin just to help with the immune system. And try some NSAIDs, which is going to be your ibuprofen, Advil, Midol, things like that, or some Tylenol, which I'm sure a lot of people take for arthritis and things. For your minor aches, if you have a fever, Tylenol does great. In the ICU, the first line of treatment we use for fever is 650 milligrams of Tylenol. It'll knock your temperature down 2 degrees just about every time. Okay. All right. So this is for y'all to answer. Antibiotics will fight infections that are caused by what? Bacteria or virus?
Bacteria.
Bacteria, exactly. What illnesses can't be treated with antibiotics? Flu, exactly, which is what kind of infection? A viral, exactly. Okay. So give me an example of some of the common illnesses that are bacterial that we could treat with antibiotics.
Strep throat.
Strep throat, exactly.
Urinary tract infection.
Yeah, UTIs, those are one of the most common. Exactly. All right, does anybody have any questions for me?
I want to ask you one thing.
Huh?
I have heard somewhere down the line when you're taking antibiotics to either you eat yogurt or drink buttermilk. Does that help?
What that is yogurt and buttermilk are actually forms of probiotics, which means they have bacteria in them that are actually good bacteria. Yogurt especially is, I recommend that a lot. It balances out the good and the bad bacteria in your gut and can actually help with digestion and actually boost your immune system because it can kill off some of those bad bacteria that are in there. And it provides a good balance. Because like I said earlier, C. difficile is an overgrowth of the bad bacteria when we kill off all the good ones. So a lot of times, if you have a lot of stomach upset, you could try a probiotic or yogurt or buttermilk, and it's really the same thing. You're just putting good, healthy bacteria into your body to balance it back out. It's a good question. Any others? All right. Well, I appreciate your time. Like I said, my name is Ben. If you have any questions, you can let me know afterwards. You've been a good audience, and thank you for your questions. Here's my references. Thanks, guys.
Very good. You need to do it. Hey, think about it. I thought he enjoyed it, but I.